programs for Saffron Cat UK. And with me today, I have my colleagues. Marcia, if you'd like to unmute yourself.
Hi, good evening, everyone. Thank you for joining us tonight. My name is Marcia Eliza, and I'm the Director for Youth Intervention and Engagement. I hope we have a very interesting show tonight, and I hope you'll be able to contribute and learn a lot from each other. Thank you for joining us.
Thank you, Marcia. And we also have on board our CEO, Yemi, if you'd like to unmute. You're unmuted, yeah. Go ahead.
Hello, everyone. Good evening. Nice to have you all on board today. It is Christmas. I thought we'd play a Christmas song and get in the mood for Christmas. I don't know why you're pulling a face. It is. Even if you don't feel like it is Christmas.
Yes.
So we're welcoming everyone in the Christmas spirit. We've got a lot to be thankful for. So welcome, everyone. And we look forward to a lot of things that we can learn off each other, things we can talk, questions that we need to ask each other, and also ask our awesome, wonderful government. So, yes, Auntie Victoria is here, welcoming you.
Welcome, Auntie Victoria. Good evening.
Good evening,
Hello, good evening, everybody. My name is Victoria Nwosu. I'm a retired child protection advisor. And it's good to join you to sort of refresh my brains because they were getting into a rut.
Oh, it's awesome to have you on board, Auntie Vicky. Welcome.
Thank you.
Especially when you think of the topic we're going to be discussing today.
Yes.
You know, you are definitely.
She's in the hot seat.
We want to hear from, you know. So yeah, thank you so much for coming on, as you always do. Thank you so much.
Okay, then. Thank you for inviting me.
That's fine. Okay, so good evening, everybody. Welcome to our Facebook
We have
Live.
Elizabeth. We also have Auntie Grace Alexander. Sorry, Giz.
Okay.
For you, so that you just acknowledge them before we lose track. Elizabeth, Imara Bassi, Imara Therapy, you're welcome. Auntie Grace Alexander, you're so welcome as well. Nice to have you all home today. Okay.
Thank you.
Hello, everyone. Thank you very much.
You're
nice
so welcome
to be amongst you. Well done for what you are doing. Thank you very much.
Thank you. Nice to have you on board.
Hi, everyone.
Thank you. You're welcome.
Hi, Amara. Thank you for coming on.
You're welcome.
Okay, brilliant. So we're going to start tonight's talk show, and like we said, it is an open mic. So once again, I want to welcome everybody. Thank you for taking out your time to come on today and to obviously listen to wherever. We do sometimes have people listening from outside of the United Kingdom, so we also welcome you from your various destinations. Today, we're going to be speaking about the effective health and social care, meeting the needs of children, vulnerable adults, and families in the Black and African communities. We can't really go far when we talk about health and social care in the UK without talking about the history of the NHS, the National Health Service in the UK. What is it? How did it come about? This is just going to be a very brief background into the NHS, which will help us to be able to understand where we are at now and to be able to help answer some of the questions that might be posed tonight. The NHS came as a result of a report that was done by a gentleman called William Beveridge, and that was in 1942. Now that report came after the Second World War, and the whole aim and objective of that report was to basically say, you know, everybody should be entitled to healthcare. Mr. Beveridge asked for every household to make a contribution, a weekly contribution, which will ensure that everybody got treated if they became ill. It was also for people who wanted benefits. So this went on, and it was seen as a way of getting the country out of poverty, out of war, traumas, and situations. Roll forward from 1942, under the prime ministership of Mr. Attlee, who was one of the prime ministers of Great Britain, and Mr. Attlee introduced the welfare state, which was the beginning of the National Health Service. But the gentleman who really, really stuck out and propelled the National Health Service forward was a gentleman called I got to say this right. We know he's known as Nye Bevan, but he was a Welshman, so it was actually Newrin Bevan, but Nye Bevan was just easier to say. And for those of you who know Hackney, Hackney is a town in the east of London. There is an estate that has been named after Nye Bevan, in commemoration. And when the NHS celebrated 70 years, he was also mentioned. And what Nye Bevan did, which was, I think a humongous step for Britain and the United Kingdom, was by introducing a free national health service to Great Britain. So he removed the weekly contributions that was being taken before under the Beveridge report, and he's made the NHS free. And we are still enjoying that service today. So the reason why we decided to give you that bit of history is we cannot take for granted that everybody knows or understands, the journey of the NHS. And 70 years down the 70 years? Yeah, down the line, we're still celebrating, and that is one of the things we've decided to talk about today, how the NHS affects our community. So please, as we've said today, it is an open mic. Please feel free. This is a time, for anything that you're not sure about, ask. We do have very seasoned NHS and healthcare practitioners amongst us, who obviously have been in the sector for a very long time, who will be able to shed some light. And as we always say on Saffron, whatever we cannot answer here, we will go away, we will seek advice, and we will come back through our social media platform and answer any and every question that you put to us. So once again, thank you all for joining in tonight. And yes, please feel free to ask. It could be questions, it could be statements, but we do ask that you keep it very, very, very civil. Let's respect each other's wishes, each other's opinions, because obviously we're all diverse and we all have different opinions. But on Saffron, we're never afraid to address any issue. No issue is too controversial for us. Okay, so I'm going to hand back to you, Yemi, you to pick up with some of the posts that we wanted to put out there.
Okay. One of the things we wanted to start to discuss was how accessible the availability of services, because we have a specific focus on the Black African communities, Black African, Afro-Caribbean. I mean, if you're of Black descent, that is where we focus our thoughts, our discussions, our support, advocacy, training, you name it. That is where we are, because safeguarding is all encompassing. It's the umbrella for everything that we do within health and social care. So how accessible would you say the services are to the Black African communities? And I'm trying not to use the word BAME, because that includes other ethnic, ethnic communities that we do not have a specific focus on. So when we're looking at the services that are being provided, how accessible are these services to our communities? Please, this is an open house. We do want to ask some questions that might not be very political. We are not talking against the government, because we all know how we appreciate social care services, the NHS, and all the services provided. However, it continues to be a point in so much research, so much reports out there, that there is a bit of a disconnect with the Afro-Caribbean African communities. So if you have had to use the services, and we're looking at social care as well. So we're looking at provisions for children and vulnerable adults. We're looking at disabilities, all the services that come under health and social care. But if you've had to use these services, have you been able to identify gaps, holes in this, where what we want to do is identify them and probably be able to reach the people who matter, who can then start to block these bridges. So please unmute your mic and have a go. It's a free mic, free house.
As an NHS worker, I fully support what the NHS has to offer, and I give credit to all NHS workers. And I would say generally services are accessible to all. The only area where I find there are limitations is within mental health. From my experience, that's the only area where I think it's not that accessible, but more accessible in terms of who provides the care. You understand what I mean?
Yes.
So for example, you hardly, from my experience, you hardly find any psychologists who are of a Black origin. And on many occasions, people of Black origin would rather speak to someone who looks like them, who understands them. That's the area where I find it lacking. But to me, in terms of general accessibility, I think it's accessible. What we do have though, is that we have people from our backgrounds who wait too late to access. You know, you wait until the last minute before you actually seek help. And that is very common among our Black men. They don't take up health as quickly as they should. So sometimes they leave it until the last minute. It also is very common with some of our very traditional elderly families who don't trust current modern day medicine. So you find that they'll hold back, or we'll try some herbal medicine, or we'll go to church and we'll pray. And, you know, in Jesus' name, this won't happen to me.
Amen.
You know, yes, God gave us doctors and he also gave us wisdom. That's why he gave doctors the skills they need to look after us. So sometimes I think in terms of the Black community, we can be our own downfall when it comes to health. What is not sometimes accessible are the hidden people. And that's where I think we have a problem generally. When I say the hidden people, you mean the one with no recourse to public funds. You know, they mean the ones who don't have proper living conditions. They're not seen. They're not registered with a GP. They might turn up to the GP and try to get help and might be turned away because they don't have a permanent address. Those are the ones we're concerned about. And those are the people we should be reaching out to. In terms of going back to Black men, one of the things our screening, our Black men don't pick up these services, and it's out there, it's free. They actually would write to them and say, come in. And this is something as a Black community we need to promote, bowel cancer and prostate screening, because our men don't go. and they wait until the very last minute when it's too late. So yeah, that's my contribution.
Oh, well said, Marcia. Thank you so much. You know, you've picked up on so many points, and the very first one is that the services are out there. Sometimes you just got to be a devil's advocate and get it, but the services are out there, and it's the fact. Other thing that you hit on the head was that we access these services at the last minute.
Yeah.
Our culture, we can't just have any show. I can't remember any show we've had without having people pull out the culture and the faith. Our culture just hinders us from, I don't know, is it the culture that hinders you, or is it the person, or how the person relates within the community and with the culture? It's a jumble of one big ball that needs unwinding. But it's that we don't want to talk, so the next person doesn't know. So they did not say, oh, it's that person, at your own detriment. Hello, please feel free to talk. If I am going to be well and walk in the streets tomorrow, we all have a right to the streets. We need to start coming out of the what my neighbor would think, what sis will think, what that woman that wasn't happy with me yesterday will think. If you're not there, they will still continue thinking and gobbing behind you as well. So why don't we put our health first before what people will think? If we speak a lot of these illnesses, you know, we're lucky. I big up NHS anytime because I know the yard where I come from, and the services that are available and not available out in the countries that many of us come from. And if we look at the services that the NHS provides, we can only be put our thumbs up and say well done. But if these services are there and we're not using them, we're not accessing them, who do we blame? So really, it is one big point which you said is that we always go last minute, and then we have the male, our daddies and uncles and brothers and sons. I do not know this. If is it the male ego? Is it the I am macho? We all get ill. It doesn't matter how how ten-pack you are. We all get ill, and we have to. Men have vulnerable. They're vulnerable. They have vulnerability sides. You know, they have vulnerable sides. Please tap into that vulnerable side and ask for help. You know, we're not an island. Nobody's an island. But together, I'm going back to our hashtag together we can. Together, if we lend a hand to each other, we can do great things. So yeah, Marcia, you did hit some nails. It might hurt to hear it, and but it's just the truth. As our communities, we need to. Master, Liz and I were talking earlier on, and I said we need to be the advocates for ourselves. We need to be advocating for ourselves, for each other. Like we say in Africa, the government can't do it all. And if we just sit back and wait, okay, the Labour Party didn't do it at this time, and the Conservatives didn't do it at this time, and the Lib Dems didn't do it, and this didn't do it. It can't reach everybody. But individually, collectively, we can pull out and tap into the resources that are there, and they are available. And it's a great one you talked about, and it's you talked about the mental health service, but it's not even just mental health service. When you have an issue that then tends to be either gender related or a cultural issue, when you talk, especially around mental health, like you said, when you're talking about issues that are enshrined or entwined in culture, and you're talking to somebody who does not have a clue about your culture and why things happened that then spiraled into the situation or the health state of your health at that particular time, then how do you relate? So yeah, should we just be shouting that we need more Black African psychologists out there? So I know there are quite a few out there. Is it that they're just not breaking the glass ceiling and reaching where they should be reaching as professionals? Is that another question that we should be putting into the pot?
Makes you wonder, doesn't it?
Mm.
It does make you wonder. And it's the same within the physiotherapy service as well. That's very common as well, where you don't see lots of physios from Black African backgrounds. So is it, as you say, they don't make it?
Yeah, where are they? Because I can count right now 6 students currently in uni who are studying psychology. So there's been a lot before them. Where are they?
It's very interesting. Yeah, in the NHS, I must say I haven't come across any.
Oh wow. And we know that you've been in there long.
Yeah.
Auntie Vicky, please, any light on that? You know, you must have met quite a few in your before you retired. What's your, you need to unmute yourself.
That's it. Can you hear me now?
Yes, we can.
When I was practicing, I only came across one, but she was very rare.
Yeah.
She was very busy because being the only one, it appeared everybody was going to her. And she was really overworked.
Right.
I think you've made a very valid point, Marcia. There are very few in the NHS. Going by my own experience, because I don't know about other people's experience, it depends on where you worked and the makeup of staff. They were very, very rare to come by. Very rare. That's my own experience. And
yes, no, please continue.
No, well, let's finish this one because I was going to talk about disability.
Please feel free.
Finish.
No,
yeah.
Feel free. Yes, go with the same.
In terms of having a disabled child, and I think we all agree that having a disabled child is like a taboo in our culture. You don't talk about it. You tend to hide the child. And when the professionals come in to offer help, you block them. What my experience is, what people do is they keep these children because they're afraid of what the professionals will do to the children. But they're interested in the money that the welfare is going to pay them for these children. For me, I used to find it very difficult to reconcile the two things. You have got a child with special needs. People are there willing to work with you, but you refuse. But you're happy to take the money, get the washing machine, get the car to take the child to appointments and so forth, you know, but then you still believe that taking this child to a church, the pastor there will perform miracles.
Yes.
And the same goes for child protection. If we have a child protection issue, they'll rather lie to you than tell you the truth.
Yes.
And you are left in a limbo. You don't know what, but you know the facts, but you can't confirm them because they're telling you lies and they don't want to work with you. I think these things are stemming from ignorance. Because our people, our own belief of what causes her, you know, somebody getting ill is different from here. Here, you will think of, yes, I'm ill because this has happened. But back home, if you're ill, we are brought up to believe it must be your neighbor, it must be your enemy who doesn't like you. They've poisoned you. We even had a case where somebody had a disabled child and she believed that they sent poison through satellite. Have you ever had something like this before? And that affected the child. And unfortunately, this child was born and she believed it, that this, whatever it is, was sent through satellite. How do we begin to address these things I think that's one of the questions I would like us to look at. Thank you.
Thank you, Auntie Grace. As Vicky, you remember, because we sat so many meetings on the Safeguarding Children Board, and these are issues that came up every time we sat to discuss this. Like I said, Auntie Victoria was the specialist child protection designated in Newham as well, and sitting and looking through all the cases that we had to fight through. We also had the case of the spirit possession, accusing a child of being possessed by witchcraft, by spirits.
Yeah.
Something's not going well, it's the child's fault. These are issues that continue to pull down. Every time we take 5 steps forward, we're taking so many steps backwards.
Yeah.
And the Safeguarding Board put out policies, programs, we had trainings, which we delivered right, left, and center. But the issue is we've got to continue, I don't use the word hammering it, but it looks like we've got to continue hammering the same message over and over again. And it's just our culture and our faith that continues to impact positively in some cases and negatively in other cases. So we are put on a scale, which outweighs the other. I don't know.
Thank you so much. That everybody, I mean, you know, the points that have been raised from youth, I mean, when you talked about accessibility, down to, you know, what Marcia talked about, representation of us in these communities. So physiotherapists, occupational therapists, you know, working in health and social care myself, I don't see them. I see a lot of district nurses, you know, but where I feel we do need, because especially when we think of the hidden people, you've got to understand that there is also a very high uptake in the Black and the African community of psychotic patients, you know, because there is a dependency on cannabis. Okay, so based on that, you've got to think, okay, when these people require you know, the help that they need, that help is coming from a people who don't understand their cultural heritage. And I think this is something that you know, when we talk of the NHS has a 10-year what they call the National Health 10-year long-term plan. Okay, now I've gone through it. I haven't gone through all of it, but I'm still struggling to find where they have honed in on culture and people's heritage. You walk into a doctor's surgery or you walk into the NHS, you know, you want to be able to see something that says your carbohydrate intake. Our diet, we know what our diet consists of, but there doesn't seem to be any kind of anything signposting, you know, which is directing our community towards that. But then you look at our community, we do have a high rate of diabetes. You know, we have diabetic patients. So you see, there is a lot that has to be done. I do like the fact that Marcia said it is accessible. The issue here is we are not accessing. Why are we not accessing? There's a lot of things. Are we afraid? Is it due to lack of awareness? Or as Yemi said, is the culture, the heritage, you know, is everything mixing? I think the lines are being blurred. It's amazing to go to church. It's amazing to believe in God. It's amazing, but you know, if you're not going to your doctor and you're going to your pastor, you're doing it the wrong way. So I think we need to maybe step back from, is it not accessible? Because it is accessible. Rather, I think what needs to happen now within our community is to raise awareness as to how you can access the services. Do we even know our rights in this country when it comes to accessing the services? And I say this because I have a case recently of a family where the head of the family had his leg amputated. He was released into the community and had no idea what he was entitled to, you know. So if we walked into our community and said, do you realize you might be means tested before you got X, Y, or Z? Would they understand what that meant? Would they know which department under the NHS or under social care they needed to go? People that live across authority, so you move from one council to another council, how does that affect the kind of care that would be, you know, available to you? So I think one thing that Saffron as an organization will be looking to do for the new year is to set up workshops where we will provide, you know, the awareness, we will provide the education through professionals, you know, to educate our community. There was a lot of you stated our men access these services very late. I do know of a particular story of a gentleman, he's actually a pastor, who hadn't been to see his doctor for 14 years. He had not been to see his doctor for 14 years. And unfortunately, he had discovered that he had prostate. It wasn't cancerous, but the point is, if he had been to see his doctor 14 years ago, you know, maybe that could have been looked into long before now, and it could have averted a lot of things. So you see, there is a lot that our community needs to do. We need to help each other. Yemi emphasized one of our initiatives is hashtag Together We Can. We must do as a community. We've got a lot of professionals within the Black and the African community. A high representation of nurses, you know, we've got medical doctors. So please, if you're listening today, if you can reach out to Saffron in any way, shape or form to be able to help with the workshops, we will be happy to hear from you. I think Grace Alexander, are you raising your hand? Yeah, okay. If you'd like to unmute yourself.
Okay. Yes,
go ahead.
I'm already they've already unmuted.
Yeah, I've done that. Yeah.
Yes, I just want to mention about what the auntie, is it Auntie Victoria?
Auntie Vicky.
Yes.
About one thing is that people from Black ethnic minority, that have migrated here, they've actually internalized disability. And I think initially, because my last son, he's over 25 years old, and he's just sitting beside me. And I realized that from that experience, he wasn't born with disability, but he started acquiring it at 7 years old. And he started having epileptic fits. And that resulted into global developmental delay. For 7 years, I internalized it. And I realized that that's dated back from when because I was like, when I got to this country, I was like over 30. So, and I had my son at 38, and you can imagine. So I've internalized it. So it has to be intentional. And one of the things is that the disadvantage of actually internalizing what you brought from home is the fact that instead of you concentrating on the strength of that child, finding where you can help the child, you are looking for cure. Even in the Bible, sorry, I have to put this. Moses was a stammerer. He delivered a whole nation. God did not cure David, but he sent a helper in form of Aaron. You understand? So one thing is that we start concentrating on the cure, and you start thinking, because everything comes from your mind. You start thinking that, who did you offend? Why me? And I think I asked that for 7 years. I wasn't getting any answer. And I wasn't concentrating on my son. I'm not seeking that opportunity, the fact that I had him in this country, seek for help, until I changed my mindset. That is when I started, approaching. That is why I went back to university again to study social work. And one of the things is that a lot of things changed in my perception, how I perceive disability. Because you will think, oh, it's your family somewhere that is doing you. Oh, it's even if we don't think about it, other people will put it in your mind that maybe your family, not even talking of your marriage, where your husband is asking you to go and do a DNA in a family, we don't have disability, do you have anything? So you understand. So and it's difficult for men to actually accept. And then we are going through all that. And if your child has siblings, you need to put an upper lip and behave as if everything is all right. Whereas you are crumbling. You know, it's like the parable of 100, the shepherd that has 100 sheep, and one of them went after that one. So neglecting the other 99.
Mm-hmm.
So you start thinking, and and one of the things is that more awareness, it's getting better. More awareness needs to be raised about disability, because over time I've learned that, one, it doesn't matter how complex their disability is, they are human beings.
Yeah.
And one thing is that your child or anybody that has disability do not need to behave in your functionality. And one of the school of thought that I believe about disability comes when there is a lack of interaction between the impairment and the environment. So the environment could be cultural, the environment could be economical, like maybe you need glasses and you don't have money to buy glasses. You need to do physiotherapy, you don't have somebody. So instead of the child's hands to be straight, some hands are bending because of lack of that interaction between and the environmental factors that is causing that disability. So, and we still need to, and the culture of silence too is not really helping us.
Yes.
I realized that I was not even, where I was living that time, there were some Nigerians. I was feeling ashamed to even tell them that I've got a child with this. I'm proud, and I realized that my son is a gift. And I thank God for using my son to see the world in a different light, and to actually see that everybody is wonderfully and fearfully created. And one of the things people don't realize is that we all have different learning styles. It doesn't matter whether you have disability or not, or the way we perceive things are different. Our personalities are different. The way we respond to things are different. And most importantly, our brains are wired differently. So how you perceive things can be different from how people perceive things. So, and it's not like somebody, I think there's a passage in the Bible that says when Jesus Christ was curing somebody who was blind, and one of the staff was saying, was it the sin of the? So, and all those in Christendom, sometimes they think maybe he has sinned, maybe he's not praying enough, maybe he's not whatever. No, all those is ignorance. So it's rather taking your mindset has to be how you are going to support your child, how you see your child, how you accept that, okay, this is what is happening. How can I create an enabling environment? Because at the end of the day, if you are not careful as a parent, you start having mental disability. It's either anxiety disorder, it's other panic attack. So many things will be affecting you that will take your focus on actually enjoying that child. And I know that when you love that child and accept that child, the child will flourish irrespective. The child will flourish, and creating a lot of opportunities, especially in this country where you don't need to buy medication, you don't need to pay for doctors, take advantage of those opportunities, and then change and enjoy yourself as a parent. Look good, don't behave like a sad person. And one thing is that every child is different, every child is unique. As human beings, we are all unique. And a lot of speak out, be proud, because when people see you, when you are hiding your child, or the way you are behaving, or the way you are looking after your child, people can see. And then they come from the perspective of pity, which I don't want. I look good, and my son look good. The best thing is not my only child, but the one that makes an impact into my life, meeting everybody, dining with kings, is this amazing, amazing young man, and he's a gift.
Thank you so much for sharing with us, Auntie Grace. That was, wow, it's getting a bit emotional. That was amazing. And I want to just say thank you for confirming that you will be with us in March 2021 for our upcoming talk show.
No problem. I will be there.
Brilliant.
Yes.
And
Our partner.
Yes,
Our
so-
partner.
yes,
I cannot hide. It's
Okay.
normally I nip in into your programs, but sometimes I have events too.
I know.
I just need to go. But
I
this
know.
time around, yes.
We
And
look,
obviously, safeguarding comes with how do you safeguard? Like I was talking sometimes about the fact that the effect, the causes of divorce is when you have a child or you live with disability. Is one of the major causes of divorce.
wow.
And one thing is that if you are not careful, you start shifting the blame on that child. And you start, either by omission or commission, you start neglecting. Is a form of abuse, neglect. People don't realize that whether you don't know or you don't know, you are actually neglecting what should be in the best interest of that child. You are actually neglecting what should be in the best interest of that child. And one thing is that seek help, speak out. You're not the only one that has a child with disability. And so what? And so what?
Yes.
Some people are going through worse things. So about doing a SWOT analysis on your child. What are his strengths?
Yes.
What are the opportunities that can enable that child to flourish and strive?
Good.
What are your threats? Face your threats. Yeah, face your threats. Okay.
Right. I'm looking forward to Auntie Grace coming in March. Auntie Grace, hold your horses. She's a firebrand.
If you can't go to university, and so what? I don't care whoever speaks like a parrot. My son is very smart and intelligent.
Yes.
So it doesn't mean when you know 2 + 2 is when you are intelligent.
No.
Do you realize that 93% of communication are for gestures?
Yes.
7% is just speech. Because you can be saying the same thing and you can say the same thing and you can say the same thing 3 times and the meaning are different through your body language, through your facial expression, through your gestures. So my son communicates. He has a sense of humor. He is very strong-minded. You can't push him because we build that confidence in him. And he's called a professor. So I don't care whether somebody is emeritus. Might have one in the house.
Yes, good on you.
I'm proud of it. I don't want anybody to see me and start saying it is well. It has already been well.
It has already been
yes,
well.
I don't want that cliche. I'm not sad. In fact, when I look back at my life, he's been a blessing. I will say that 100 times.
Brilliant.
Thank you so much, Chris.
Because disability can either be acquired or you can be born with it.
Yeah.
My son was not born with disability. You understand? Before, I wasn't using glasses. Auntie Victoria, now, you think you can do 20 years ago? You can't do it anymore, can you?
No, I can't.
One way or the other. So let's enjoy the moment.
Yes.
Let's enjoy them. Yeah. So at the end of the day, it's about being accepting who you are. And one thing is that do the best for that child. Okay, like one man, I usually buy dresses from that man, and I saw him today, and I was saying, "How is your son?" He said, "The son has very complex. He's autistic. He's autistic." So he was telling me that he has started doing with his mentor. He started working in Sainsbury's now. I said, "Wow! For me, that's a big deal. A big deal.
Yeah.
At least he's achieving some level of independence."
Yes.
My son goes, when he knows that I'm doing Zoom now, he doesn't disturb me. Sometimes he can just come and look at me that this woman is talking again. Okay, go away, go away. You know, you allow you enable, and then meet with other parents. If you have a child with it, meet with people that can enable you, people that can support you, people that can help you. You know, it's not, don't keep quiet about it. Don't keep, if you are going through something, don't keep quiet about it. And one of the things is that when I say domestic violence, because one thing is that maybe you want to be a lawyer, or maybe you study as a lawyer, you couldn't be. You start blaming the child, putting the guilt that is you that have not actually given me the opportunity to be who I am. But explore other things you can do as a parent. Don't do like, oh, my son, yeah, you know, cleaning the house without actually finding what you can do. You can still fulfill your passion. So the child is there, fine, but you need to have a me time.
Yeah.
You need to have it. You need to enjoy yourself. You need to look after yourself, because if anything happens to you, nobody else can do what you do to your child. So you have to look after yourself. You have to create a me time when you can enjoy yourself. Then find something creative to do that can make you earn money.
Brilliant.
Find something, not that, oh, you know, this is my child. I have to do this. I have to do that. And so what? What about the lockdown? That's even worse. But I make sure what I've learned, I've done during lockdown. I've never done it before lockdown. So it's about maximizing time, connect with other parents that are having the same children with you, go out with friends, maybe for 1 hour, enjoy your moments, and that is it. And God will hear our prayer.
Awesome. Thank you so much. And we really are looking forward to March. So don't release anymore. Just hold up, hold back for us.
Good on you. Well done.
Thank you so much.
Thank
you so much for sharing and for allowing us into your world. And you know, you're doing an amazing job. And yeah, it's you're right with what you said, and I'm so happy that you've come out here to say that, because you would be an inspiration. There could be somebody you've touched tonight, somebody that really needed to hear what you're hearing or what you're saying, you know. So thank you. And you know, if there is anybody out there, you know, and you are on your own and you can really resonate with what has been said this evening, don't be alone. Reach out to Saffron. We can connect you with Auntie Grace. We can connect you with other people, other like-minded people who are going through what you're going through. That is the essence of our doing these shows. If we're not making an impact in the community, then obviously we're failing in our job. So thanks again, Auntie Grace. That was amazing. As she said, you know, she wanted to talk about disability, and like we said, we'll be covering that extensively in our March program. We've actually scheduled all our talk shows up until April. So in March, Grace Alexander will be on one of our talk shows. So please, you know, stick with us, stay tuned. 2021 is gonna be lit. It's gonna be lit. Okay, so yeah, back to today's show. So yeah, we want to hear from everybody else who's on here. And what I'd like to hear, I know we have some of our viewers on from Nigeria.
Jacqueline put her hand up. She wanted to say something.
Okay, Jacqueline, are you on?
Yeah, I'm
Hi,
here.
how are you?
I'm doing great, guys. I've just been listening with rapt attention. It's been, Auntie Grace Alexander, I want to thank you. I know that she must have passed through some sort of fire to get to where she is at right now. But as a Nigerian who, you know, has always had this impression, like, okay, so the minute you step off the continent, you know, you just drop everything, all the baggage, all the cultural and emotional and whatever not baggage that you might have as an African, and you begin to live a new life. This session today has been quite eye-opening for me, I must say, because hearing you people speak about Africans not being able to access even the facilities that are available in your times over there for cultural reasons. It's amazing that we carry who we are with us wherever we go.
Yeah.
Because the situation that you people just painted, or a few moments before Auntie Grace did speak, was like, you know, what we're going through in Nigeria. You know, as a health program producer also, I've had problems trying to even locate a psychotherapist or psychologist in Kaduna State. As a matter of fact, the Kaduna Neuropsychiatric Hospital is the one and only place that actually caters to more than 10 states. I mean, I've heard people come all the way from places like Enugu, Anambra, to come access, treatment in the neuropsychiatric hospital over here. So for me, it's really, really, it's an eye-opening session. There was a question that Yemi asked that I would really love to hear an answer to. Where are all the psychologists? Because you said you've had the opportunity or privilege of meeting quite a number of African or Black um, students studying psychology. Where are they? Because they certainly are not on the continent. Because I feel like they understand that on the continent they would not get as many as much business, let's put it that way, or clients because of the culture. You guys, I'm on a Zoom meeting. Can you please keep it down? Okay. So I was trying to talk over them, but it wasn't possible. Anyway, thank God you guys understand. So, but where are our Black psychologists? Where are they? Because like I said, they're not on the African continent. As a health program producer, I have a hard time, very difficult time getting people like psychologists, nutritionists, things like that. Because in Nigeria, people will tell you that, have I finished feeding 3 times a day before you will start telling me that I need the services of a nutritionist? You understand? That is our mentality. Then of course, you know that people in Nigeria, when you say, I need to talk to someone, if you are not going to talk to your pastor, then you are not serious. That's the way everyone that's the general, thought process that, and then there's also this kind of, you're not a grateful person. You have it so good. You have a house, you have a car, you have children, you're married. So why do you need to talk to anyone? That's ingratitude, though. Okay, please come and close this door for me. Can you?
Okay, good.
I'm sorry, guys. Sorry,
No,
but
right.
that's just it. The people, you're not a grateful person, and don't let God be angry with you because you have so much more than a lot of people out there, and so you really don't need to talk to anyone. So for me, like I said, eye-opening session to know that we actually have um, a commonality around these issues. It just goes to show that, well, I don't want to use some bad proverb or something, but it's like saying, you can take the pig out of the mud, can't take the mud out of the pig, because it's amazing that people would be in climes where you're able to access some sort of services, and you're still not accessing it because of these shackles that one would think you would have left behind back home. So it's amazing. Always, I wish I could find a way to always have these sessions on, extract the audio and have it on air, because like today's session, I cannot but help think that there are quite a number of women who are loving children who are living with some form of disability or the other. And there's this point she made too, a very salient point. We are all living with disability. It just takes for you to take a good look at yourself, and you'll know that I'm actually disabled in one way or the other. So the question is there anybody who is not living with disability actually? So it's a whole thing. I've had opportunity to meet mothers with kids, with Down syndrome. And these women, if they tell you their stories, it's something that might cause you to weep. What they have to go through alone. Alexander, come talk to to them. It's something that would have a huge impact on the lives of so many people listening. So yeah, but please let's not forget, where are our psychologists? We need them though. And with what is going on the continent, we're going to be needing them even more in a few short years, because it's a whole mess right now. It's a whole mess. Yeah. Thank you.
Thank you, Jacqueline. Can I just, okay. While you're talking about where our psychologists, and I just noticed that we have Saffron SDGF, our NGO in Nigeria. We have one of the directors, Tolu Makinwa, and I know for sure that as part of the Saffron support scheme, especially after the SARS incidents and movement and going forward, I don't know if you can speak. Can you unmute yourself, Tolu? But because I know that she's linking up with you're laughing. I will call you out because I know that she's linking up with psychologists and so many other people with regards to that support scheme. So just 2 minutes, just let us know, where are the psychologists on the African continent?
All right, good evening, everyone.
Good evening, Tolu.
Wow, it's so good to be here again. Yes, for the Saffron Support Scheme. So Saffron Support Scheme is a body of an independent specialist. And so we are partnering with other initiatives to provide psychosocial supports to young people who have been traumatized due to the whole hijacking of the protests. So that's where we are on at the moment.
Okay. What would you then be the answer to give to psychologists? How have you been? Are there that many psychologists, or what were you looking at in Nigeria?
Well, I would not say, well, anyway, there has been one or two challenges, and that's in the area of getting people who are willing to offer pro bono services. First and foremost. And, a lot of Nigerians are so money conscious. Even when it comes to partnering with other grassroots initiatives, you would still get to hear about, okay, what is in it for me? And now we are not talking about in kind, we are talking about money. Yeah. So that has been one challenge at the moment. That has been a challenge. But then a lot of people are ready to share and provide a database system. That's what we are working on as well. And we've just found out very few people who are willing to advocate with us as well. So there's been a lot of hindrances anyway, but we would definitely surmount that. We'll definitely surmount that.
Okay, thank you so much, Tolu. Yes, sorry, over to you. I just wanted to find out. Yeah. Auntie Grace, you had your hand up. 2 seconds.
It can be very expensive. But at the end of the day, having a peer support group, you understand, can make a lot of difference. Even speaking with other parents who are actually accepting and they're doing well, but also be about, he who knows it feels it. And yes, that's very key. So if somebody has a child with disability and the person is coping, the other person is coping very well, that can serve as advice, and how you can regulate your emotions, how you can live, because you feel a sense of loss. It's a form of bereavement when you have a child with disability. One, you don't know how to go about it. And you can imagine, even when you are here, you are still feeling what next? The fear of the unknown. You understand? It's so critical.
Oh, she's unmuted. She's muted herself.
So very challenging. Yeah. And one thing is that my question I usually tell parents is that, how do you see your child? That will say a lot. Then I take it from there. How do you see your child? Then a parent will be able to listen to another parent that is well, rather than somebody who doesn't have a child with disability, and then you are preaching to that person, or you're telling the person, you know what, God is in control. When you are taught God is in control, the thing will come out the next
next year.
Exactly. So it's about the fact that it's a process.
Yeah.
And it has to be intentional. It's not something that, you know what, I just have to live with it. No, it's a process, because you still feel relapse, because every stage of that child is different. Look at COVID now. Look at COVID. You understand? My son has not been to school since, has not been to college since March. And because he's susceptible to it, I did not even allow him to go now. Because it has to do with a lot of, I think I did a program on COVID and parents of children. Knowledge is power. So, and one of the things is that every stage of that child life, if one is not careful, you start having anxiety disorder. That is a kind of panic attack. Because what next? Okay, how am I going to deal with the fact that the child is a teenager now? How am I going to deal with? But for me, what works for me is that I see my son not different from any other 25. I see him as different, and I treat him like a 25-year-old. But but at the same time, I'm cautious of his differences and limitations. Yes. But it doesn't mean I have to start treating him like 3-year-old or 4-year-old, or somebody talking to him as if he's 2-year-old or 4-year-old. No, he's a professor.
He is a professor. Yes. Yeah.
So, and at the end of the day, I don't mind talking, because somebody was mentioning my name. I don't mind talking to other parents who are going through that. But the parents need to be intentional about whether maybe the parent wants to sink or to swim.
Yes.
So you want to get on with your life, because and they don't realize that if you're not happy, those children are not happy. They can feel the environment. So they have emotions. The way they express their emotions are quite different. Sometimes we might not even understand. But instead of the child to be flourishing, there are some things out of that lack of love, the fact that the child cannot even come to you directly, or the child is not really confident about what he needs to do or what she needs to do. So it's about the fact that we need to know how to regulate our emotions.
Okay.
But that's a process. It's
brilliant.
Thank you so much, Auntie Grace.
Thank you. So yes, oh wow, there was quite a lot in there, and thank you, Jacqueline, for your input. Yeah, there was okay, Adebola is on, and Adebola is one of our directors too. Good evening, sis, welcome. You typed, so I'm taking it that you're unable to come on and speak, so I'll read it for you. You basically told us that there is a website, BAATN, Black African and Asian Psychological Therapists. If you go on their website, you can get a Black psychologist here in the UK. Yeah, that's amazing. But I think the issue here is, where are they?
They're not within the circle, the system.
Yes, exactly. You know, it's amazing they're in a website, you know, but you know, you've signposted. What I don't understand is, you know, for me in the field, you know, when I've gone into clients from the BAME community, the Black African communities, I don't see them. So when they go in, amongst the Asian community, the elderly people like to be massaged, right? They like you to use oils and massage their arms. Now, for healthcare workers, that is difficult, because if there is a case of osteoporosis, you cannot be massaging somebody because you can hurt them. Okay. If we have people who understand the culture, then from a medical point of view, they would be able to, or they should be able to advise. And this is why we're saying, yeah, okay, we can look into going on this website, seeing how we can connect with some of them, but seeing how and why they are not already out in the community where they need to be helping these families. So, but thank you so much for that, because it's good to know knowledge is power. So we can always look on the BAATN, Black African and Asian Psychological Therapist website, see if any of them would be happy to even come on the talk show and give us an insight as to how, where, why, what, because the questions that we're asking, it's people from that site that might be able to answer. Yeah. So yes, thank you.
I was just thinking that is it just also because of a lot of privatization? So a lot of these cases are then referred out, as opposed to having them within the circle of the hospitals or the services.
Yeah.
But what I'm thinking, a lot of privatization is
also a factor.
Yeah, be a factor to that as well.
Definitely a factor, because I know that from when dealing with doctors who are in the NHS, you can also see them in their private practices. Yes. So they won't be available to be seen in the NHS, hence a lot of cancellations with operations. Yeah. But if you go to private, you are able to see those same. So it's very possible, speculating, but you know, there is some method in the madness. Okay, so you know, basically, just to take us back to today's show, we also had earlier on, myself and Yemi, where we were discussing things like Meals on Wheels.
Yes,
I have had the opportunity, obviously because of my background and what I do in health and social care, so when I'm visiting clients, and I've gone into houses around the BAME community, and when Meals on Wheels, which are government funded, it's a government funded meal scheme, which is delivered to clients who live on their own, obviously vulnerable with disabilities, you know. Yeah. I look at some of these foods and I think to myself, this person isn't going to eat this because it's not what they're used to. And this is not an indictment on any of the food being prepared. The point here is, I think that what has to happen in healthcare is every community has to be treated. Every community is unique. We as individuals are unique. There is not another Giz. I'm a twin, but I'm still unique. The same way the Somalian community has a uniqueness. The Ghanaian community has a uniqueness. The Jamaican community has, even the Dominican community is separate from the Jamaican community. Everybody has their own uniqueness. Therefore, why would you then prepare a general meal of potatoes and peas and throw it out there? You are no longer, it is no longer a person-centered service that you are offering. And it needs to be person-centered, because if you look at when we're talking about the deliverance of care, when you're looking, if you go through the NHS long-term plan, which is a 10-year plan, and they are specifically honing in on providing quality care, which involves person-centered care, well, we're not doing that. Mm-hmm. So, you know, if there is people out there who are involved in the preparation of the meals within the community, please can we do something? There is not one shop, even the big supermarkets now sell Black and African and Caribbean food. When I was growing up in this country in the 70s, I could only go to the corner shop of Mr. Ali's Butchers and get what I want. I could never go into one of the main supermarkets and get my pounded yam or my whatever. Now you can. So I don't think we have an excuse anymore. We need to help the community. We need to make sure that if Mr. Obi wants to eat okra soup, Mr. Obi gets okra soup provided via Meals on Wheels. So yes, if we can go out and have a curry, if we can go out and have an Indian, we get Indian takeaways. Yeah. Let's think about that. We're not. We need to strip back. We need to come together as a community and strip back. You get an Indian curry, you go for a Turkish. Okay. So these people that stay in their communities, in their homes, why can't they get Meals on Wheels in the same way? Mm-hmm. Yeah. So yeah, I don't know if anybody else agrees with me. I mean, I'm not trying to cause a food war or a food, but I'm just trying to say, you know, I am very much in favor of person-centered care. And you know, how I care for Mr. A will be different from how I care for Mr. B, because their needs are different. Their needs are individualistic. And I think this is what we need to be looking at when we're talking about healthcare within our community.
In saying that is, I was just thinking that, okay, you know, we're so diverse. Please look at it this way. The African community on its own is so diverse.
Yep.
And but I'm going to cause a riot now. There is one meal that I think at least 50% of the African communities recognize.
Yeah.
And it's a big up for the jollof rice. So even if it's only having the jollof rice as one of the meals that's integrated into that, as an African or ethnic meal, and maybe a couple others, at least there needs to be something in there that's representing the diverse cultural community or England that we live in now.
Mm-hmm.
Yeah.
I think what you do then is say, for us, the jollof rice, it could be rice and peas for the Caribbean community. It's important to look at the community that we are serving, okay?
Yeah.
And that every community has a basic staple meal. Now, it could not necessarily just be rice, because then there might be a few people who carbohydrates is not what they want.
Yeah.
But it's about service user involvement. Speak to
Exactly.
them, find out what it is, what are their needs, what are their requirements. Then we now try and tweak it, you know. And I think this is something the government can look at to do very easily.
Simple survey would help. Simple survey polls would help to identify, and you can then look from there. If you, as a researcher will do, put out the survey and then get the numbers or the actual foods that look for 5 that resonate or stand out within the whole collection of the survey, and then try those 5 to start with.
Okay.
I'm sure a lot more people would appreciate it.
We'll go away, do our research. And what we can do is, if we can come back maybe first quarter of 2021, with something, because this is something I like us to talk about it, but I'd also like us to actually actively do something about it, because I've got to be honest, I do get a bit frustrated when I have to see clients who haven't eaten, not because they're not hungry, but that's not what they're going to eat, you know. So yeah, it's something we can proactively look to you know, trying to change, because that's what it's about. Yeah.
I also think that I think this is going to clash with our come in line with the programs we're discussing for February. But why don't we look at our communities' streams of income? Let me just put that. Developing a company or a service that provides these meals. So we are talking to people who probably don't even know what the foods are or what the cultural demands are within those foods. So why don't we as a community have some people who then diversify into producing those meals?
Yeah, very easily done.
Very easily done.
Very easily done. Okay. Brilliant.
Welcome, Dee. Welcome, Adebola. Good to see you. I was seeing Adebola's face. I was saying, yay! Good to see you.
Welcome, guys. It's good to be here.
Thank you.
Our 2 Saffron directors who do a lot behind the scenes. You know, I know you hear from myself and Yemi most of the time, but you know, when we say the wheels are spinning, these 2 ladies are part of those wheels that spin. So they do drop stuff for us, and then we run with it and make it look like it's us. But you know, we are a team, and they do show up. So thank you, ladies, and thanks for coming on. Some of them
look out for Deborah's videos.
Yes,
she does.
Debbie does all our videos on our YouTube channel.
We need more of those.
Yeah. So thank you, ladies. I don't know if you have any input in what we've been saying today. I mean, we've talked a lot I know you're just joining, but just a quick recap. We've had some, very, very, very detailed information from, obviously, I think she's on, Grace Alexander, relating to the disability, and how it affects marriages. I mean, I was really shocked when she said it's one of the child disability in the UK is one of the things that pushes divorce in this country. I think the pressures, and this is news to me, to be honest. But in hindsight, when you think about it, it possibly is a very difficult situation for families to handle, and you start wondering, is there no support out there for these families? Why must they shoulder this alone? Why must having a child that has a disability be the cause of a marital breakup? It's very sad. So this is why it's good to talk, because now that has come up, we can look into possible, looking to do awareness classes for parents who have these children. We could possibly look at, we have a center in Kent, and on a weekend, if we have in that community, we could provide an outlet where we have the children down on a Saturday, which gives the parents time. Because like Grace Alexander said, she mentioned it, she said, no matter what, the fact that you're looking after this child or these children, you must have me time. And me time is important, whether you've got a child with disability or not. Most of us mothers and fathers, will back me up when you just need some time away from it all, to recharge your batteries and just get yourself back to. So that was what we spoke about. And we also spoke about accessibility in healthcare for our community. It's not that the accessibility is not there. We are just not accessing, we're not asking the questions. We probably don't know the right questions to ask. Do we know our rights as regarding healthcare? What is available out there for us? What are we eligible? What is the eligibility criteria for getting X, Y, Z? I own a property. Will I be entitled to this, if that happened? You see, all these questions are very, very important. And within our community, I can tell you for a fact, not many people know what is what. So, we are putting it out there tonight. Saffron, we will be doing quite a lot of workshops this coming new year. We've done a lot of talking from March when we started our voiceover talk show. 2021 is going to be a lot of action. We're taking action because talk is good, but talk doesn't get you the results. And we are a solution-focused organization. So there will be a lot of workshops coming along. There will be a lot of interactive sessions that we will be doing both online and off Zoom. So please, if there is anything that you feel you're struggling with, you see, we've had immigration, we've had, UK and the police community and us and the black community and the police force. We have a high representation of our children in prisons. Please come out, speak to us. Let's see where we can engage with you and cross you over. That's our job. We're going to be here. We'll be back from the second week of January after the Christmas. So you have enough time to get in there so that by the time we do come back, we've got a lot of shows coming up, but it doesn't matter. We will still do the workshops, which will facilitate whatever needs to be facilitated. After we did our home office engagement program, we were inundated. And that, I was happy, but I was also sad. And the reason I was sad is because what that told me is the number of people sitting in this country, not talking, having issues, and getting possibly deported, not because they've done anything, but because they didn't do anything. Guys, speak up. If you don't speak up, nobody understands or knows what you're going through, and we can't help you. Yeah. So yeah. So thanks for today. We're still on it. We're still on the topic for today, and that is obviously healthcare. How effective is health and social care within the Black and African community, how it affects children, vulnerable adults, and families. Yeah. So please feel free to throw anything out. Ishalua Akintunde, I hope I've said your name correct. Akintunde, Mr. Ishalua Akintunde, you are welcome.
Hello, yes.
How are you? Please excuse my Igbo voice that said it, but I think I got it right. I like to pronounce people's names properly. So I hope I did your name justice. You're so welcome today. It's so nice to have you on. Can you hear us?
Yes. Yes, thank you.
Okay.
Yes, I can hear you. You correctly pronounced my name. That's correct.
Wow.
Thank you.
Wow.
Thank you
I'm
for having
proud.
me.
You're welcome. So yes, like we said, it's an open mic, so please feel free. I'll tell you something that I wanted to talk about, and that is the fear of the authorities. Would you say that a lot of the reasons why our community doesn't step forward when it comes to seeking help, or you know, I know a lot of people who are ill, a lot of people who don't seek medical attention, and for the life of me, I don't know why. Is there a fear of authority within our community? What are we scared of? What are we afraid of?
I think Auntie Grace pointed out, which I actually noted it down right by that topic. And she said the fear of the unknown.
Right.
When you do not know, or you can't anticipate what the answer is at the other end, then you probably tend not to ask the question. And thinking, oh, they know, they are the professionals. I don't know anything. But the idea of going to the professionals is because you need help. So we need to change that mindset of that same phrase came up when we had the immigration vulnerability team as well. And it was that fear of the authorities. That's why people do not go. And they're not biting. They actually, when I found out a while ago that they had a vulnerability team, speaking with Yemisi, I said, there's a vulnerability team. They tell me about it. You know, you wouldn't have thought so, but yes, there is that. So I think it's just, yeah, fear of the unknown. What do you think, ladies?
Okay. Adebola, you asked a question today, and I did like the way you phrased it. So we don't want it to be like it's just a negative spin within our community, because obviously there are some people in our community who actually are doing the right thing. So what you said is that ask people the challenges faced in this day and age in meeting the needs of the Black and African and Caribbean child, especially with COVID. How have the challenges increased? What are the present day challenges? Also, what is working well that people want to share? Good practices, positive progress, and stories about how Black and Caribbean children are being supported to achieve well in life. So you're on. I don't know if you want to, you know, do better justice, because I was obviously just reading what you typed. So,
hi, this is my sister. Hi, family.
Hello.
All right. What was I gonna say? Can I just touch on some just before you asked me to answer that question?
Yeah.
Something that you I'm not sure, maybe it was you that raised it, Yemi or Auntie Grace that raised it, but I just want to stress that something just come to mind, that one of the challenges I think we as the Black community face is sometimes we shoot ourselves in the foot. We are trying to put across the perfect picture to professionals, and we're trying to paint a story. And one thing about lie is one lie, you have to cover up one lie with another lie.
Yeah.
And once you get into the field of trying to max things, you get yourself pretty much caught up in the old web of it. And when you're found out, the authorities start to work against you, because that's sometimes what happens within our community. We want to paint a perfect picture. Oh, I've got family, I've got people that can help me, and you're leaving the children on their own, and the children are going to school and they're saying otherwise. So there's quite a lot of things that we need to be very open and honest with. Number one is when the local authority does categorize a child in need as any child that might not be able to meet their development according to Section 17 of the Children Act 1989, or a child with disability, or a child that would be impaired from meeting those needs without the adequate support. So in that local authority, it is the duty of every local authority to assess any child that is categorized as a child in need. You're not doing yourself any disfavor, you're not doing yourself any favor by trying to make it look better when there is really a need and you need to ask for help. And that's something that we need to be very aware of. When we come to children with, I've worked with children with disability teams, and one thing that I have to say is, and I'm not even going to hold it back, when we talk about the other communities, especially the white community, they would make noise, they would fight their corner, and they would get that service. Us, we will back off, only because we've started to manufacture, build up these stories, and then we're being found out, and then we just back off. And we need that support. And that's something that we need to be aware of, is that the local authorities does have a duty to provide that support to you. It is the right of that children, and it is not about you, it's about your children, it's about getting that support. And that's something that we do need to build on, to give ourselves confidence to challenge and challenge and challenge. Even when they say no. Why are you saying no? Why is a social worker not coming to visit me when I said that I'm struggling? Why is there not an assessment? And then I have to say this, I have seen it over and over again. People have come to me to say that when social workers sometimes come to them, they say, oh, you have families, what about your church? Really, it's not people making assumptions for you about the support that you have. You just need to be open and honest that you don't have that support. It's not everyone that has that perfect family situation. And it's not everyone that has a village surrounding a child. But sometimes in the mentality of a lot of professionals, it takes a village to bring up a child. And that assumption is often brought in. And sometimes we need to challenge that. I'm a single mother, I'm on my own, I have no support. I'm not even in contact with my family. That's my decision. That's not for you to judge me on. That's for you to take that information and tell me the proper services that need to be put in place. That's number one. The second thing, when you talked about the Meals on Wheels, I'm just thinking, guys, is it not possible that part of the reasons why we don't have ourselves being represented in this field is because we don't know the criteria to put ourselves forward? Like maybe what they're expecting, health and safety certificate, these where the feeds are going to be cooked and all of that. Do we need to get a list of that criteria in terms of what Yemi was saying about this being an additional income, and make it available and empower each other? Because that might be one of the reasons why we're not being represented, because we're just not able to go through the quality assurance of what is expected of us. And maybe we're just being afraid of it, but you know, is what they say, the fear of the unknown. We're always quick to be afraid rather than say, okay, this is what I have. Or if people can join forces together, if I can cook beans and you can cook jollof rice and you can cook rice and peas, and we can do 3 of us joining forces together to do this thing and make it work. I'm just saying, I think that's another avenue to look at that. And yeah, I forgot what I was going to say before. I think that's enough.
Okay, thank you so much. No, that was amazing. Thank you, thank you, thank you. I think you have Elizabeth Bassey. You've written, would love to look into Meals on Wheels or something similar for Black and ethnic groups. So you're basically echoing what Debola has just said, you know, and what you raise a very important thing. It's possible that the rigmarole, which is not a rigmarole, is due process, especially when we're talking, you know, giving food, you know, food hygiene certificates would all, you know, you need that to understand where this food is coming from. We need to talk about the pack. So it's all about legislation and getting it done the right way. And that is possible. You know, if people can do the burger shops at the market stalls where they're selling burgers I don't see why we can't do Meals on Wheels, you know. So you see, well, Adebola, you've just nominated yourself. 2021 is going to be lit. So, you know, on a serious note, we will definitely look into doing it, you know. And one thing we've got to think about, when you look at post-COVID and what is happening, a lot of services have been stretched to zero. So a lot of the services who probably were offering such are not. So this is the best time than ever for us to step in, even if it means doing a bit of background research and a bit of legwork. But hey, it's totally doable. So yeah, thank you so much for that input. And thank you, Melda, because you've just typed something there which is in line with what Adebola is saying. So thank you, ladies. You see, it's nice. The spirit is one. It would make me so happy to walk into the home of a Ghanaian family, the home of a Somalian family, the home of a Yoruba family, and see what they want to eat being given to them. Because Jewish care provides meals daily.
Yeah.
It's pure kosher. My daughter
Yes.
attends a Jewish school. The meals are pure kosher. So nobody can turn around and say, why do you want this? We want this because our community wants it. And I think it's their right to have it, you know? So like I keep saying, 2021, ladies, we're going to be busy. We're going to be busy, but yeah, let's do it.
Boom.
Okay. Thank you so much, everybody, for that piece of input. What else do we have? Yes, we did talk about knowledge of services. Does our community really know what is out there? Are we aware what is really on offer? And I think what we'll do as an organization possibly is we'll get together and try and see if we can put up a list of every service possible and put it on all our websites and everything, because the world has, one good thing COVID has done, it has taught people who have never used a laptop to use a laptop. That's one thing I've taken out of COVID. I love it because people I that didn't have any knowledge, you know,
they're connecting more.
So this is the best way now to be spreading information. We'll put things out there, you know, because that's another thing. We can't blame people for not accessing what they do not know. And you'll be surprised, so many people don't know that this and this or this and that is ready for them. So yeah, we will look to do that. Does anybody else have anything that they want to add regarding to? I would like to hear about the children and the healthcare. We haven't really focused much on children's services, in case there are parents out there that are listening.
Before we go on, can I just also point out that when you're talking about accessibility, a very big barrier, and it's also something I'm writing about, and it's just language. There was a report, and this was a while ago, but it's been looking into child protection and social care with 8 boroughs, looking at how they're incorporating the policies into their services. And yes, they're running these policies and they're trying to make it work. But right from the reception, there was a blockage in communication, which was language. So when you're giving people from different languages the same, you know, English or maybe a couple other languages where you think, okay, yes, we've interpreted it, but then they're in so many other languages that people can't read from. So is it that and we do have clusters of translators, but when they come into play, they come into play much later. So if you had a case and you wanted to, you're sitting at a conference or a meeting and you're having translators, but well before, and they're asking that at the reception, how can we filter out more information for people to understand? And I think that has always been an issue. There was a survey for eight boroughs, and all 8 failed us at the first door. So how do we go from there? Like you said, if they don't know, how can they access?
Yeah, and another thing is also when you're talking of the languages, because I do find like some hospitals and doctors, they do have scripts in various languages. What I think we need to be asking is it covering a wide range? So, you know, us which part of the community is being left out or is being eliminated? Does that make sense? So you might have all the European languages, but then you might not have Igbo language, and you do have a lot of elderly people in this country who English is not their first language. You know, you've got grandmothers coming over, grandfathers coming over now, and they're looking after. They're the ones who are the carers for the children, but English is not their first language. So I think it's a good thing would be to look into the languages that are not being represented out there and see if there's ways. It shouldn't be difficult because they've got existing languages out there in literature. So we can find out the languages that are not there and just see how we can, you know, get it addressed.
You know, when you're in the waiting room, you have these televisions that are everywhere.
Yeah.
And you're showing us the news. Why can't those TVs be used, you know, record video messages in different languages?
Yeah.
And put that out. Marcia.
Yeah.
I'm not sure if you remember, since I've left the local authority, years ago, everything in the local authority was translated into all the various languages. However, that was stopped to encourage integration, which sounds ironic, but makes some sort of sense. What they were saying, if you continue providing everything in all the various languages, you are not encouraging people to learn English. So that was a justification that was used, I know, in Newham in social care, because we were translating child protection minutes, we were translating, and that was stopped. We were providing newspapers in every different language in the libraries, and that was stopped because they saw it as a way of creating integration. But because what we were finding young people being taken out of school to come to a hospital appointment with their parents and their grandmothers and their aunties and their uncles.
Yes.
So that was happening.
Because they were the translators.
Yes. So they thought a way to stop that was to provide English classes. And I must give Newham its due. I'll talk about Newham because I know Newham. I must give Newham its due. There were years where all sorts of short courses were offered in different languages, so people can be encouraged to learn new languages. And yes, I know in hospitals we provide language line, and sometimes we allow interpreters, but it's really limited, and it's also a cost. It's very costly to have an interpreter just for a hospital appointment.
Yes.
So the government is looking at cost, but also the spin that was put on it was integration. Because if we continue to provide, what they were saying, if we continue to provide everything in all the various languages, we'll never encourage people. And that also is linked to, you know, is it the citizens test, whatever test you do, that came out of that as well. That's why learning English culture and English language became a part of that immigration process.
Yeah.
So it's a catch-22, and
Okay. Yeah. That makes okay. Auntie Vicky has to go. Okay, thank you so much.
Thank you.
Thank you so much, Jacqueline. You said your battery's about to run out, so we thank you all the way from Kejuna. We're very, very, very happy to have you. Take care. Be safe. And we hope to see you next week, Wednesday. But yeah, back to what you're saying, Martia. Yeah, I get that. It is catch-22. And the reason I say it's catch-22 is because you have those that obviously English is not their first language. Going 2 weeks to learn English in an English school is not going to let them speak
It's not going to work.
These are people that do not go out because that's not what they were. That's not what they do. They stay in. So then they have a hospital appointment. They have an emergency. They need to go to the hospital. They need to communicate. They can't communicate. So yeah, I get what you're saying.
Yeah, they don't get turned away.
No, they won't.
But they don't get the best service because the communication becomes a barrier.
Exactly. But like you said, the cost that is involved as well is also, so with cost and the idea of integration, I guess that's where, you know, it is difficult.
And there were definitely safeguarding issues because they were taking children out of school to take them to their appointments. We had a lot of social care places where kids were coming with just to do the translating. I've been in hospitals where there's a 10-year-old or 11-year-old with their granddad, so they can translate. So that was happening because even the other adults in the family weren't able to translate. So you'll only have the children who were UK born.
Wow.
Who were able to. So they just don't want to provide a society of dependency on the state.
Yeah.
It's about money.
Is it ESOL?
ESOL and EL.
ESOL, yes.
Yeah, but they've changed it now. It's something else. It's another. ESOL's gone.
Same thing, different name.
English as an additional language, I think. But yes, it's interesting that it was how it happened suddenly that they decided we just withdrawing every literature in the library that was in another language.
Right. Okay. Well, you know, this is why it's good to come together and talk, because obviously, you know, everybody comes from a different borough, and it's nice to see how, you know, boroughs. I'm very familiar with Newham. It's a borough I grew up in, and that's why I said I know they were very, very good with the languages. In the 80s. I mean, you know, you had a very high representation of the Asian community, and everything was in Urdu, Punjabi, Gujarati, which I found really amazing. And I thought that for me was integration, you know.
Interesting, isn't it? Yeah,
very interesting. But yeah, I still think there is a lot of issues, because when I did a training in Haringey, I found that there was a particular community there, very elderly community, and nobody speaks English. Nobody, you know. And you can imagine if there is an emergency, or sometimes the carers have to go in there, and you can only have the same language speaking carers in there. Otherwise, we couldn't provide care because there's no sense of communication. So it's all these little things that, you know, we need to look at and see, because otherwise you could have a serious safeguarding due to the miscommunication, you know. Just one, the major thing I always worry about when we're talking about healthcare and when there's a breakdown or lack of communication is with medication. It just takes you to give the wrong medication because either the person didn't get you or you didn't understand what they were saying, and it's all over, you know. So I don't think this is something we can just overlook.
No,
we'll go back, like I always say, do our research and speak to the powers that be and see that if the regulators have anything that they're doing that we've missed, or anything that is upcoming.
What? Yeah. Go on. Yeah, sorry.
Yeah, no, that's what I just want to say. Anything that's upcoming in the future.
One thing that Newham did, and also I think when I worked at the hospital, we did as well. If you spoke another language, you sort of had a register where switchboard knew that you spoke that language. So if someone turned up in ED and they couldn't understand them, you had that list.
Yeah.
Yeah.
And then they call upon you that can speak that language.
So you will come down. Yeah. So staff were used. There are times where staff were used as interpreters as well.
Yeah.
And it's true, because I remember a couple of times we had to go and sit in child protection cases, especially when you speak like the Yoruba language, and a couple of okay.
And another thing with safeguarding as well, why it was an issue with bringing relatives to translate.
Yes.
Because we didn't know what they were saying. So that's what was another issue as well.
Yeah. I'll tell you,
you probably had the perpetrator in there as well.
I'll tell you the story that we had and why we actually I actually ended up having to sit in one, and then I became the dog's body and sat in a few more. But it was because we had a family, a family who had brought a girl over from Africa as a minder for their children, and they were literally mistreating her. But what actually flagged it up was that she was underage and she was pregnant.
Oh.
Okay, so it was father was normally in the house with her while everyone else is going to the while everyone else is going to. I don't know, do you remember that? You remember? We were sitting in that same place together. And they had an interpreter. The interpreter, which was a verified professional interpreter, would sit there, and because the interpreter was just colluding with the family.
Right.
So the girl says like 3 sentences, and the interpreter comes with for five words. And so the manager at the time knocked on my door and said, "You speak?" "Yes, I speak." "Come in." And had to sit through there, and it was too embarrassing to sit and hear what was going on. And that's flagged it up, and we actually wrote a new set of policies for interpreters within yes. And it was, do you know, we had to go like, how well do you know the family? Do you have any contact with them at all in any way, shape or form? And it became very, very hard to weigh, should we not?
Yeah.
So yes, until we had to replace that, I was the assimilated interpreter. But yes, these are issues that will continue. And I think we continue to grow in social care. We continue to grow from these experiences, and that's why you have policies. You review, you add, you remove what's not working, and vice versa.
Yeah, definitely. Awesome. So I think what we've gone over today, I am hoping that we've been able to touch somebody out there to say, you know what, I am going to go and see my GP, my physiotherapist, my oncologist, whatever, because please don't sit at home, your ailment. Please don't let your children sit at home if they need to be seen. You will not be turned away from any hospital or GP, like we said last week when Dr. Nathan was on.
Sure.
You are not allowed to be turned away if you need medical assistance. It is your legal requirement. It is your legal right, in this country to have that. The hospital is not the home office. They will deal with you medically. If there is a separate immigration issue, it will be dealt with. The only time, and even if, God forbid, even if you have a criminal case, you will still have to be seen medically before they do anything else. So please, guys, within our community, I'm begging you guys, stop with the not going to get yourselves seen. Our men, our fathers, husbands, brothers, guys, go and get yourselves checked. I'm begging you, this idea of, I don't know if I'm going to call it bravado. You don't do bravado with prostrate. You don't do bravado with cancer. You don't, see a lump and think it's fine. I'm a man. No, those days are gone. Those days are gone. You have to get yourselves checked up regularly. And I will say this, pharmacists now, I live in Essex. Pharmacists now, you can walk into your pharmacist. Yeah. They can be your first point of call. Sometimes some of the tests that you take, there is a charge in the pharmacy, but sometimes you walk in and there is no charge. You can go to the pharmacist. They've got a little like office, so there will be privacy. if there is some basic thing that you need to be seen to, you've got a lump somewhere, if a pharmacist will look at you, and if the pharmacist needs to refer you on, you will be referred on. So, please, I know there's been a lot of issues with calling your doctors, and because of the COVID situation, you're not always being seen on time. Don't let that be an excuse, okay? Delay is not very good when you have an ailment, because it's like a ticking time bomb, and by the time you go, it might be too late. You don't want to be the had I known. I don't like had I known, yeah? So please, and if you feel that, everything that's been said today, you still need more clarification, please hit us up on all our social media websites. We're going to put it on the Saffron page again tonight. And I'm going to endeavor to put the social media handles out on each week so that you can't say you didn't see, okay? We thank you so much. It's 4 minutes to 8. It's been another informative session. Thank you all who have joined from Facebook. Thank you to all my directors, you guys rock. Mara, thank you. You've been on, and as much as we don't see you, but you've been, you've participated. So thank you so much. And I hope you'll come on again next week when we're back. And Grace, thank you for your, I don't even know how to thank you, but I just feel sitting here, you've really touched somebody. I'm looking forward to seeing you here in March. Just quickly, guys, we're coming to the end of the year. We've got 2 more weeks to get rid of 2020. If you lot ain't excited, I'm excited. What we're going to be doing for the next 2 weeks, we're going to be looking at, Yemi, help me out here.
We're looking at next week. We're actually celebrating our community, businesses within our community, and we're actually looking for a lot more of the smaller businesses that we need to bring forth and celebrate them. It's been a hard year from so early in the year, and a lot of these businesses have suffered. But within the COVID era and pandemic, we've had businesses that have sprung up. We just want to bring them to light so that that they're available. We can patronize them, hopefully, and also appreciate and recognize these people who have reached out and come out to try to develop things in the lockdown like we did. We had the voiceover, which started in March because we needed to continue to reach out to our communities, and in order to bridge the gap, the voiceover came about. So hey, other people out there did certain things within that time, and we just want to recognize them.
Yeah. Thank you.
Thank you.
So that's what we're going to use to close off the year. So if you are a small business out there, please come on, showcase yourself, okay? Use this as your virtual LinkedIn. Let's network, let's get together. Even some of my directors, you guys do things, I see you all. I need you all to come and shout yourselves. They're just smiling, they're laughing.
Our coaches, our mentors, our clinical psychologists.
Honestly.
Award-winning social workers.
We've got brains here, but they're just hiding. But don't worry, guys, we're throwing them out for you guys within the next 2 weeks. They will come on. So if you do have your businesses, no matter whether you've just started, every little day starts a story, okay? Yeah. Come on, tell us what you do. You don't know, it might be something that I've been looking for the past 2 years, and then boom, one of you has it, yeah? So, if you don't promote yourself, nobody's going to promote you. So come on, let's do this together.
Giz, did you see my comments in the comments place?
Did I see your comment? Oh God, I got my glasses on. Yemi, your scarf, tie, and earrings are singing lovely. Listen, do you know what? You know what? I love that. You said, Yemi, your scarf, tie, and earrings are singing lovely rhythm. I love it.
That's it.
As she came on this evening, I'm looking, I'm like, you bought that hat. You didn't buy it for me. It's not a hat, guys. It's a scarf. And she's done that now. If I buy 20 scarves and give her and I say design, Have I not started scarf business? Yes, I'm an Igbo girl. You know we like business.
Hey.
But listen, guys, that is how Chanel started. That is how everybody started.
Yes,
so please, let's showcase ourselves. 2020 has been such a difficult.
Yeah, me. I can teach you how to tie the scarf.
Definitely.
Yeah.
You know I'm coming. You know I'm coming. 2020 has been a difficult year, but in as much as it has, we've got to take the positive out of the negatives. You know, we've had such an amazing time with all of you from March till now. We've got a family. Saffron has got a family. It's been the best part of my 2020. I've got to be honest. You know, I've met some amazing ladies, and I'm going to let you all into a secret. The only person I have met on here now is Yemi. So you guys have to understand that you don't have to physically have seen somebody to grow. These are virtual. This is a virtual family. So a lot of the people that come on here, we obviously because of COVID, we haven't always been able to interact. You know, 2021, we hope that that's going to be different, and we'll be able to see a lot of you that have come on, a lot of you that have joined us through Facebook in the flesh. But please, guys, continue to network, continue to stay engaged with us. We will be back next week, Wednesday, and we'll have some guest speakers on. Just look out for the adverts. Please stay safe. Keep doing what you've been doing, and have a blessed evening. Thank you, Facebook Live. Have a good evening, everybody. Good night.
Okay, good night. Bye.